I'm Todd Neal with MedPage Today. Ahead of the American Stroke Association's International Stroke Conference in Los Angeles, American Heart Association President Ralph Sacco, a neurologist at the University of Miami, previewed some of the late-breaking abstracts that will be presented at the meeting. He first talked about the CONSCIOUS-2 study, which evaluated the effect of clazosentan, an investigational endothelin receptor antagonist, in improving outcomes after subarachnoid hemorrhage.
So the investigators looked at a new class of medicines that can be used to reduce stroke and ischemia that occurs from vasospasm after subarachnoid hemorrhage. Subarachnoid hemorrhage is a very devastating type of stroke that can be very much fatal or lead to other types of ischemia, lack of blood flow in the brain among those who bleed from aneurysmal subarachnoid hemorrhage. So in this study, a large number of subarachnoid hemorrhage patients who already had their aneurysm treated were then given this intravenous medicine versus a placebo to see if they can reduce the effects of stroke after subarachnoid hemorrhage.
The company developing the compound, Actelion, released the initial results of the primary endpoint in September. There was a 17% relative risk reduction in vasospasm-related morbidity and all-cause mortality with clazosentan, but it did not reach statistical significance. Also being presented at the meeting are results from the Scandinavian Candesartan acute stroke trial, which looks at the effects of treating high blood pressure early for acute stroke.
This large randomized trial took acute stroke patients within 30 hours of their stroke and randomized them to candesartan, an angiotensin receptor blocker, and an effective antihypertensive versus placebo. This is really the largest trial that is looking at this in acute stroke patients, and it will help us understand about when we should be treating our acute stroke patients with blood pressure lowering medicines.
Another randomized trial, the LEAPS trial, evaluated a rehabilitation program following stroke.
We know our stroke patients need new innovative approaches to improve their long-term outcomes, and rehabilitation is crucial to the outcome of a stroke patient. In the LEAPS trial, locomotor experience applied post-stroke, nearly 408 stroke patients were randomized to a very structured experimental rehabilitation program, either early, within 2 months, or late, within 6 months, versus home physical therapy. We need more effective randomized clinical trials to really get better evidence-based approaches to improving outcomes in our stroke patients. This LEAPS trial will be very important information regarding the most effective approaches to improving the outcome in rehabilitation for stroke.
Also at the late-breaking science session, researchers will be presenting results from a large database of patients with ischemic stroke who underwent intracranial angioplasty or stenting, which is still experimental.
Our latest American Heart Association, American Stroke Association guidelines only recommend it when all else fails. This large review of hospital records looks at what the landscape is for angioplasty and stenting for brain arteries currently in the United States.
Sacco said that there is a large NIH-funded randomized trial underway that compares angioplasty and stenting for intracranial blockages. Check back for additional coverage of the American Stroke Association's International Stroke Conference. I'm Todd Neal.